Good morning, class. My name is Amani. My full name is Mrisho Amani Mbidikira, but you can call me Amani all the time. I'm going to do a demonstration today about the making the IV bag, and it's going to be like about 15 minutes. So keep a track of me. Make sure I'm within that time. It's like 11:22 right now, so about 15 minutes is going to be like 35. Okay. We're going to do a demonstration how to make the IV bag, and this is the IV bag. As you can see, it's can you see the name? No, it's 5% dextrose and 0.45% sodium chloride. This is like food actually, like I said before, and we need to put the medication in there just to help you out for something. Whatever you're suffering from, we gotta put in there. So you can ask a question like, why are you gonna give me IV bag and not a regular pill, like tablets, small thing that you can swallow, right? Or why not give me injection? There's a reason for that. Sometimes you're so sick, you can't talk, you can't swallow. So if you can swallow anything, we have to find another way to give you medication, right? So we can either use injection or we can use the IV bag. Now injection, when I say injection, this is what I mean. We can put a medication in there and shoot it in. But sometimes, like I say, you need to eat, so we have to put some other material for you to be able to get a medication and get food at the same time. That's the reason why we're doing that. When you do IV, before you start making that, we want to make sure we don't put any, we don't introduce any bacteria in there, and that can cause infection, and infection can cause death or any medical complication. So what we need to do just to make sure when we make this bag, it must be very, very clean. Now the technique to make it clean before you get it is called Aseptic Technique, and that's what we're going to demonstrate today. Like, how am I going to be clean so I don't give you dirty? That's the whole point. So I have to gown up. So the number one thing that you need to do is to have a lab coat, and this is a lab coat that you can put it on, right? As you can see, just like a regular gown, or I can have something different. And I think it's not in there. It might be in here. The small one. No, we don't have today. So I'm going to go with that one. Or we can have this one here. This is a disposable. It's a disposable gown. Right? It's the same thing. Just like that. So you can put it on. I don't know if I can fit in there, but I can go like that. And I can go like this. But this one is kind of open over here, so we try not to use this one here. It gotta be something that fits you really, really good, right? So this is my gown here. I'll put my gown. And sorry, kind of wrinkled a little bit. I put it in my car and it's messed up, but you know what I'm doing, right? And once this one is done, I'm gonna be very quick. Okay, so you'll be gowning up in a special room. There is another room, we call it IV room. IV means intravenous solution. I for intra and V for venous. Venous means vein. It's just a biological term. So we're gonna put through your vein. We have two types of a blood vessel, right? One bring blood from the heart going to the organ, to liver or something like that. And then there's another one from the liver back to the heart. So the one going from your heart to the liver, that's artery. The one that bring you from the liver back to the heart, that's a vein. And that's what we're going to shoot it in, right? So we call it the IV because of that reason, intravenous. So before you go to the IV room where we make intravenous solution, you have to gown up, and that's what we're doing now. So that's the first process. And then you're going to put your shoe covers, because you'll be walking on the street and you're bringing some dirty. We don't need none of that. So you gotta be clean, just like you're going to the surgery. So you're gonna dress out. Can you see me now? No? Let me be over here so you can see it. So I'm gonna put my shoe cover. And my shoe is kind of big a little bit, but you can see that, right? Can you see it? Yeah. Yeah, right there, right? And then I have another one here. That's another shoe cover. All right, that's quick. So I got two shoe covers, as you can see in the video. I have 2 shoe covers, that's not all. Then you're gonna put your head cover, right? Because if you have hair going into the bag, it may go into the system and block it. Believe me, just small particle, like a hair particle. If it goes in there, it blocks something, you're gonna have a heart attack, or you're gonna have what do they call it, like a brain attack. You never heard about that, right? That's what we call stroke, right? You know, you're gonna have like internal bleeding, and you're gonna go crazy, you know, in 5 seconds. So we try to avoid that, and it's a good thing I don't have a long hair, but some people like ladies, they have a long hair, so they gotta put it together. And usually they're not allowed to do that. You know, it's better to have a short hair. So you're gonna put your head cover, and they come in the different sizes. You know, this is one of them. Am I good over there? Yeah. So we're still going on. Now, I have a jewelry. They don't recommend this to, at all. You know, you have to take it off. If you have a watch, you have to take it off. So I'm gonna put it in my pocket. Most of the time, we put it in a locker, you know, because you know you're coming in for business. So you don't need none of that. No cell phone, none of that stuff, right? So like we're going to do surgery. This is a real deal. If somebody open you up, you don't want him to be dirty and put some stuff in there. You know, once they put you together, 2 or 3 days later, you have infection going back to surgery. You don't want that. So what we're gonna do then, I have my head cover, I have my shoe cover. The next thing we need to do is to wash our hands. So we're gonna go somewhere, you know, and wash our hand. I hope you can see me there. Keep it disappearing on the video. There you go. So you're gonna wash your hands, you know, gonna use soap or aseptic solution, you know, scratch your fingers and nail bed and all that stuff. Once you're done, you're gonna dry your hands with a paper towel, and then you trash that, right? Everything have to be clean and used only once, right? So everything that I got on, I'm gonna take it out and throw it away, okay, when I'm done. So once you finish washing your hands, you're gonna put your gloves on. Once you put your gloves on, the next thing you know is to cover your mouth. No talking once you get in there. You can talk if you have a partner there, like if you do surgery, you can talk, but you try to minimize that. Because you got a bacteria. Human body has bacteria, that's natural. Some are good bacteria and some are bad bacteria. It's just natural. We have good people, got bad people, right? The bacteria is the same thing. Some bacteria, you're supposed to have it. If you don't have it, you're gonna be dead. And some bacteria, you don't have to have it. If they are there, they're gonna kill you. So it's the balance, you know, it's all about, you know, kingdom over heaven. So you're gonna put your mouth cover. So I'm gonna put this in there, and I'm gonna look like this. And at the same time, you gotta protect your eyes, because sometimes you can mess up, it can splash in your eye. These are chemicals. You don't want them to go in your eyes. So you're gonna protect your eyes and your mouth at the same time. So I'm gonna put it like this, but I'm gonna take it off because I gotta keep talking, right? So I'm gonna look like this at the end of the day. Like that. Am I there in the video? All right. So I'm full gun right now, okay? I don't have to touch anything that I don't need to touch. I am clean, so I'm gonna go into an IV room. When I go into the IV room, this is supposed to, just imagine I still have it, you know, but I'll put it aside. So once you get to the IV room, imagine you have a box. Imagine you have a box, right? Like you have a wall here, we have the top, and you have the back. This place right here is open, okay? The front one is open, this one is covered, this one is covered, this one is covered, and then the top is covered. We call this the hood, H-O-O-D. H-O-O-D, biological safety cabinet, or biological hood. You know, like a hood, you got the hood, right? Like my friend right there, just like that. So you got a cover. This is a special machine, that's where you make the medication. What it does, it has a wind about 120 miles an hour. It's blowing back this way. The reason why we have that wind is just to blow the bacteria away from the medication. So it'd be blowing toward me. Now when I get in there, I have to clean that place, and the way you clean it from the bottom, and you keep going to the front. So the wind will be blowing up going this way. If you clean it backward, you are bringing bacteria into the machine. So you want to clean from outside going out, from interior going outside, and once you clean that with the alcohol, then your place is clean there. The next thing you need to do is to have your bag, which I have over here, and you gotta open it outside, trash it. Once you trash it, you put over here, and once you put over there, you have your alcohol swabs. These are alcohol swab. You take your alcohol swab. Gotta do another one. That one ran away. and you trash. All this is gonna go to the trash. It should be right next to you. You trash it, you clean it, right? And that's where medication is gonna go in, so it should be clean, no bacteria, no virus there. But usually it's bacteria, because virus can survive outside. Gotta be inside your body. So you clean this very quick, you trash that. Once you trash, you bring your syringe. Now, there are so many different types of syringes. There's a 5 ml. This one is 5 ml, the maximum. This one is 10 ml, okay? It can go to 20 up to 50, the bigger one, the biggest syringe. So you have your syringe right here, you open inside, everything is inside. Don't do it outside over here, connect and come back. You bring bacteria, you already clean this area, and you have to make sure you stay in there. So you open this one inside there, you trash this, you put aside, and then you bring your needle, right? You bring your needle, and I already have a different kind of needle. That'd be better. They look like I don't have another one, so I'm gonna use this right here. Okay, here we go. So this is your needle, and make sure again, don't open outside, open inside, and you can put it up right here, and then you go to your medication, and don't block it like you do over here, because when you block this one will be blocked, right? So you make sure you do it in a different place where you have the wind. Now when you go in, make sure the bevel is down, or there's a little slant over here in the needle, I don't know if you can see it, but there is like a little slanting position, like an angle. So the angle have to go down, don't make it go this way, you gotta go down like that. Otherwise, you're gonna poke a little particle from the plastic, you're gonna put it in there. When it goes in there, as it runs into the vein, you're gonna block the vessel and you're gonna have a stroke, either the heart or the brain. Whenever you're gonna go in and block it, right? So you're gonna go a bevel down, go in there, put your medication. You have to do calculation, like how much you're gonna put in there. There's a concentration. If it's a 20 milligram in 1 ml, that means if I need 40 milligram, I'm gonna pull 2 ml, right? You know, if you have 20 people in one car, and if you need 40 people, you're gonna need 2 cars, right? That's like that. That's the calculation. It's very simple. So you put your medication in there. Once you put your medications right here, you come back to your bag, make sure it's clean. You can clean it again if you want. I'm speaking loud so I can get my voice in there. You can clean it again and make sure it's clean, and then you shoot it back in there. So I'm shooting my medication in there. Make sure everything is inside the hood. You know, once you push in there, you can take air out. You see all this thing at the top is air. So you can take it out. Once you take that out, you can put your needle back into the safety material. Make sure you don't poke yourself. It happens a lot if you're not careful, or you talk to somebody, you don't pay attention. And these medications, they're very deadly. You don't want to be poking you every single second. So once you finish there, you trash that and you trash your needle, and this one is ready to go. Now, once you finish, you have to cover this top so nothing else is going to come in because it's clean now. Now, you can use anything that you have. Most of the time, we have like a special seal, and or it can be like in this form, like a little, the yellowish thing here. I hope you can see it. Doesn't look there. But it's a little thing that you have to put over here on the top, and you cover it. Or you can use just a regular thing. You cover your stuff. So next time you go to the hospital, you know, you pay a visit to a friend or relative, whatever, you can look at it so you know what's going on there. They have to cover it. If it's not safe. So you cover like that, and then you have a special label. Every medication have to go to a certain patient, so you're gonna see a label here, right? If you go to the hospital, you see a label. So if you receive this medication, you look at the name, it's not yours, let the nurse know, this is not for me. Because when they make that, they make for you, right? So they have to cover and say, okay, you're gonna get maybe labetalol, and you're gonna get Lasix, and you're gonna get different names of medication. So if I give you something that you don't need, that's gonna be dangerous. So make sure you read the name. Once you read the name, then you're just fine. You know, you finish this, you take your syringe, and you show the pharmacist. I'm doing as a technician here. You take your syringe and you show to the pharmacist like how much you put it in there, and you have to show like what vial it comes from. So you put it there, and you show how much you put it in, and this is your medication. So the pharmacist will come in and look at it. They know what's going on. Look at the vial, say, oh, this is the right medication. How much you shoot it in? Is it 4 ml? 40 milligrams, they always said before. And what name of the bag? You know, he confirmed that. He put his signature there. And you put your initials. You say, okay, I did it, and he check it. And now he's going to go. He's ready to go to the floor, right? And that's how we do it as a pharmacy technician. Like I said, it's a very simple job. If you want to become a technician in the future or want to become a pharmacist, this is how we're going to be doing every single day. And that's about it about my presentation. I appreciate it for being here, and I hope to see you guys around, right? Thank you so much.